So when we're looking at treating patients with Botox who have neck pain, what you will often find is that they have neck pain. You can examine the patient and find pain often emanating from the little joints, the facet joints in the neck. But what often happens is they get spasm in the muscles, particularly the trapezius muscles, which are the big sort of flat muscles at the back of the neck and top of the shoulders. Now, in order to break the cycle of the pain, we'll often use analgesic medication, painkillers essentially, and physiotherapy. But in some patients, that's not enough. It doesn't work. Medication's not effective, they get side effects, etc. And sometimes in those situations we may look at slightly more interventional type treatments. Now, where muscles are affected in neck pain, what we can do is some very, very simple little injections with Botox. Patients will come in either to clinic or the hospital to have the procedure done. It can be done under local anaesthesia, although sedation can be given if required. And essentially, the trigger points are small taut bands of muscle, and they can be very, very painful. Essentially, if you press on them or palpate them, they can essentially send pain radiating from that point outwards. What we do is we clean up the area of the muscle, as I said, particularly the trapezius area and all the muscles around the neck. We will identify those trigger points, so we put little circles around them. We put tiny amount of local anaesthetic into the skin to anaesthetise the skin, which is the most uncomfortable bit. Once that's all nice and numb, we will use a very small needle and carefully administer that into the trigger point. Once we're in the trigger point, generally you can actually feel a little grip of the tip of the needle, and then we will administer a solution which will contain a long-acting local anaesthetic which is mixed up with Botox. Botox is very effective for the treatment of this type of pain. It's thought to have two major activities. The one that everyone is familiar with in cosmetic practice is muscle relaxation. So one part of it is that you will get local muscle relaxation of those trigger points. And the other effect is that some of the Botox actually goes back to the spine itself, to the spinal cord, where it has an inhibitory effect on pain. As with all procedures, there are benefits and risks. The benefits are pain relief. It will take 10 to 14 days to work, sometimes less, sometimes more. Risks, failure, local bleeding, bruising, infection, discomfort, which are all minimal. One interesting thing with Botox is very occasionally, and I see this once every year or two, patients can get myositis, which is an inflammation of the muscle. It looks as if there's a redness and inflammation there. It goes away after 2 or 3 days, but it can be quite red, sore and itchy for a couple of days. You also have to be very, very careful about potential muscle weakness. People worry very much about that. In clinical practice, it's only really an issue if you have patients who have very, very small muscle bulk or are very slight in their frame. If you use the Botox routinely, as I do, and you spread it around the muscles, and you're looking at significant sized muscles, it is not a significant problem.